Welcome
Mhm.
everybody. As Professor Chi from the University of California, Davis taught us, good morning, good afternoon, and good evening. And this was taught to us during many educational webinars. But this is not a webinar. This is a different initiative for true care. That is the acronym of Together Reporting Unbiased Education, while CARE is the acronym of Certified and Regulatory Education. This is an innovative format in which we are trying to reproduce the informal sharing of the so missed coffee breaks, for which we are going to enjoy wonderful coffee today from Costa Rica with the specialist in veins and lymphatics, Lorena Grillo, with our specialist from general practitioner field, Silvia Porres. And since our first and ultimate goal is always the patients, with dear friend Yvonne, who will represent indeed the patient. So this will last not more than 15 minutes, like a coffee break, or in this case, water break, because indeed the transparency like water is one of the messages we like to deliver, since the project is on the Venus Road to the Winter Dubai, focused on fake news. Lorena, as you know, we started this initiative because we read a paper reporting that 40% of medical websites are including potential fake news. And these fake news are shared more than 450,000 times. Now, we deal with Vena, like in Pura Vena and Pura Vida motto of your organization, Flebolatam. And this means that we actually deal with the leading cause of preventable death, that is venous thromboembolism. So I'd like to start talking about veins and venous thromboembolism and your experience on the field in Costa Rica about how much it is perceived, this association between varicose veins and the thrombotic risk, or how much your patients are actually coming to your office in Costa Rica and really not considering that more than an aesthetic concern. What is your experience in this, Lorena?
I think that maybe when our specialty started like having more approach and knowledge for with the patients and other medical practitioners, uh, firstly it was seen as a very aesthetic approach of the disease, but eventually as time has gone by, it has been like turning up to the other side, to the physiologic part, and now people are also getting this great like a novel experience that the venous system is so important in the everyday life, and eventually it could cause so many problems related to that could affect their quality of life. So it has been more communication regarding these aspects, and also the involvement of all these webinars that we have been doing in these pandemic times has been able to have better information for the patients also, and not only to the practitioners, specialists and general practitioners also, and other fields that are also related and are going to have the first contact with the patient. But previously it was all approached mostly through an aesthetic type, aspect. Now it has a broader perspective, and also there's much growing interest, also because of COVID and its relationship with maybe an augmented rate of venous thromboembolism. It has awakened the curiosity of the patients and the population in general.
Thank you so much, Lorena. And indeed, I'd like to know from Dr. Silvia Porres, who has been also involved, and I'd like to deeply thank her for participating to the 4x4 project dedicated indeed to the synergy with the general practitioner. Your point of view, Silvia, because in reality, the literature is showing that more than one patient out of four presenting just aesthetic concerns in terms of, for example, spider veins, is actually presenting a reflux, so a deeper issue in the venous system. In your GP, in your general practitioner office, how is it perceived from the patients usually when you see these legs with varicose veins, and what is their feeling about that? Is it like more an aesthetic concern, or do they already know that something more could be hidden behind?
I think, but good, it's nice to see you, everyone. So I think there is kind of 50-50 and the concerns about the council about Venus diseases. A lot of the younger women are concerned about the aesthetic one, but maybe women over 40, they are not old actually, they are so young still, but women at that age are concerned because I feel not comfortable. They have pain, they have symptoms that maybe the day a day just for work, that is a very complaint at the end of the day. So I think there is a 50-50 concern about this kind of the problems. And there is other things too that maybe are being more frequently consulted is before we have more consult in women's, but now there is still a lot of consult from men's. People that work like a security guards, for example, they stand it all the day. I have a lot of consults frequently with that kind of people that work standing all day or sitting all the day. So I think that is so amazing because just before a few years ago, maybe we didn't have that kind of patients in our office. Now we haven't. So we have the concern of this kind of people now about the disease, about all the things that we do, like examine it, we are always only a clinical overview because we don't have instruments to measure things, to know the veins flow, everything. We have only the clinical in this kind of patient, but we know that some patient, maybe they don't have like a very hard disease, but they have problems we not show like kind of this vein, the big vein that that we are concerned that we don't like to have in our legs. So that is the thing. Maybe they can make maybe a delay in the diagnosis and the treatment of these patients. And there is something maybe I say in my consult what happened, and then I think maybe it's a very common concept in all kind of doctors like me, like a general.
That is very interesting, Silvia. And tell me another thing, please. As you know, lymphedema, so the accumulation of fluid in between the cells, and we are not talking then about veins, but lymphatics, is considered a hidden epidemic. And a lot of time, these patients are presenting swelling and they consider themselves fat, but in reality, it's accumulation of fluid that is strictly associated with vein disease. Do you think there is awareness about this from the patients and also from your colleagues? Or is it like it was written in some papers showing that less than 50% of the GPs are actually properly informed about these issues in Costa Rica?
Maybe the thing that I'm gonna say maybe is not nice to say, but I had to say it because I had to be honest. I think maybe the lymph disease, nobody cares about it. That is something not good to say, but I have to say because it's not venous disease. Okay, this is the problem. The people don't treat it, don't send it to the specialists. Even I think mayor of we don't think about it. So that is something very worry about the formation we have in universities about this kind of diseases. I think we have a lack of formation because we don't have much maybe rotations in a hospital in vascular surgery. Actually, because we are maybe if you're going to practice as a general doctor, you go in general surgery or you got urology or other surgery, but you don't go to the vascular. There is something worry about it, and that's maybe there is a lack of knowledge about this kind of disease. I think there is not only Costa Rican problem. I think it is a Latin American problem too about this. So, but about this kind of disease, we don't treat it. I mean, some people that maybe have a medical continuous education think about it, But the people that don't do that, don't think about it, don't treat it, and do not refer to the specialist.
Thank you for having given a meaning to our idea of drinking water, indeed, for these 15 minutes being as transparent as water, because indeed this transparency goes all around the world, since it's not even just a Latin America problem. The World Health Organization has defined lymphedema as a hidden epidemic. In the same way, and this will be my last question to you before moving to Yvonne, is about the forgotten disease, as it has been defined, which is the pelvic venous disorder, meaning that very probably you have all heard, and all the patients have heard about male varicocele, while not so many know about the female varicocele, so a reflux from the ovarian and pelvic district of veins, that is actually the second cause of pelvic pain. Now, pelvic pain is present in 1 woman out of 3. And in your GP office, in your general practitioner office, this means that every 3 women you are looking at, 1 has pelvic pain. And the second cause after endometriosis is actually venous refluxes. So would you agree that also in Costa Rica this is a problem, or are you already in contact with, for example, gynecologists and vascular experts to deal with this?
Well, I have the opportunity in the hospital that I work that I have very close specialists just next to my door. So, but this woman with pelvic pain is very, very often, and they are not, they don't respond very good to medication. I thinking about anti-inflammatories. They don't respond, and they persist with the pain in a chronic way. Sometimes you refer the patient to the GI, and they don't have very clue about the disease. There is something, because I have 2 patients, actually just recently, that they have dysmenorrhea, the pelvic pain. They don't have cause about it, and I send it to the vascular. He treated, and both the women are doing very well now. So I learned about it just because I have this kind of patients. So I look for myself and say, oh my God, all the patients that I had before, I didn't think about it. You know, I hear something in a 4x4. I hear something about this that I wasn't thinking about it. So yes, very often, doctor, there is a lot of women with that problem. Now that I know what to do. Just before, I know what to do.
Thank you
that
so
is
much.
Something worried too. Yeah.
Thank you so much, Celia. This is absolutely important to be reported. And now finally, the most important one of the day, of course, Yvonne. So we will ask for this time translation in Spanish from Lorena and Silvia. Yvonne, welcome. You are the protagonist, of course, of today. And our request to you is to guide us through the journey that you had as a patient, starting from the issue you had and who you approached first as a physician, and how much you were eventually exposed to fake news in terms of products, suggestions for treating your disease. Lorena, please guide us through Yvonne's story.
Saludos, doña Ivonne. Realmente para nosotros es un placer que usted participe con nosotros en este primer evento, como tomarnos un café y poder compartir el especialista, el médico general y un experto a nivel mundial como el doctor Gianesini, y hablar un poco sobre la enfermedad venosa y su experiencia como paciente. Entonces, nos gustaría que de una manera breve y precisa nos pudiera relatar cómo ha sido su experiencia con el diagnóstico de trombosis venosa profunda desde el momento de que empiezan los síntomas y se puede lograr el diagnóstico en su caso. La escuchamos.
Gracias, buenas tardes y un gusto, un gran saludo para todos. Bueno, mi primer episodio de trombosis fueron 2, pero en forma en varios años después, ¿verdad? Despacio. La primera fue en el año 1996. Fue una trombosis. Me inició con falta de respiración. me sentí muy mal, la pierna muy inflamada y recurrí a varios médicos, pero me habían dicho que posiblemente me había picado un mosco y tenía que mantenerme en reposo en la cama con antiinflamatorios, pero no lograron darme un diagnóstico en ese momento. Me mantuve en la cama, pero los dolores eran muy fuertes en la pierna y la pierna estaba sumamente inflamada. Al pasar de los días se me fue negrosando, morada, totalmente morada, cuando en realidad recurrí a otro médico especialista y me dijo que no, que tenían que llevarme al hospital urgentemente porque no había, no sentía los, vamos a ver, los pulsos, es correcto. Y yo me sentí muy mal, muy mal, de verdad. Y recorrí al hospital y me llevaron y fue cuando me diagnosticaron la trombosis. Me tuvieron muchos días con sueros, con medicamentos anticoagulantes. Eso fue en el 96. Poco a poco fui recuperándome, gracias a Dios, y logré recuperar bien, ¿verdad? Pero no me mandaron más anticoagulantes después de una semana.
Okay.
Duré apenas 8 días con anticoagulantes.
Una pausita, doña Ivonne.
Let me, Yvonne, just translate a little bit for all our worldwide friends and colleagues. So Yvonne reported that she experienced thrombosis that initially was considered by the physicians as simply a bite of some bug, for which she just received for a long time anti-inflammatory without a proper treatment. So this points out a very frequent condition in which a clear case of potential thromboembolism where there was distress in the respiratory system and also an inflamed leg was actually associated with an insect bite rather than the first or at least the leading preventable cause of death according to the WHO. So very interesting story. And then there was a second episode, if I understand correctly, Lorena, right? So
yes, there was a second episode. ¿Cuántos años después, doña Ivonne, tuvo el segundo episodio?
El segundo episodio lo tuve 10 años después y en la misma pierna.
And was this time treated immediately properly?
En esta ocasión sí recibió tratamiento más oportuno y adecuado.
Sí, claro que sí. Inmediatamente ya supe, sentí lo mismo. Entonces, ahí mismo, como decir que sentí al día siguiente, pero decir al día, un día después, me fui y me atendieron en el Hospital México en emergencias y de ahí me internaron, que fue la segunda trombosis que tuve, pero ya tenía mucha deficiencia respiratoria. Ahí sí me tuvieron en un lugar que se llamaba cuidados intermedios.
So to translate, sorry, going to interrupt it, just to translate to the international ones. The second time it happened, it was of course followed better because she knew already what was going on. But my question to Yvonne now is if in the meantime, between the two episodes, if she was properly instructed about lifestyle, risk factors, the use of media compressiva, were all these things considered by the physicians, Lorena, or was she just left alone?
Doña Ivonne, nos pregunta el doctor si durante el lapso del primer episodio y el segundo tuvo un adecuado guía sobre el tratamiento, el seguimiento, el uso del soporte elástico y medicación, o qué pasó en ese intervalo, digamos. Usted nos mencionaba que solo estuvo anticoagulado.
Sí, fueron con vendas de compresión. En ese momento fueron vendas con el primer episodio. Y me dijeron que ya a los 2 meses me podía quitar las vendas. Y la anticoagulación solamente me la dejaron por 15 días y después me la aumentaron a un mes más, pero nada más, ya luego me la quitaron del todo, ¿verdad? Ya cuando fue el episodio segundo, fue donde ya me la dejaron de por vida. Ya, eso sí, ya cuando me dio el segundo episodio, 10 años después, en el 2006, ya ahí sí, ya me dijeron que no, que como era el segundo episodio, tenía que estar anticoagulada de por vida.
So
Sí.
we understand from the story of Yvonne that the first time she used the bandages just for a very short time, and then in the second episode she has been assigned to lifelong therapy with anticoagulation. It's not clear about the compression. Was she using compression like lifelong?
She started using compression after the second episode.
Lifelong?
Lifelong, yeah.
Okay, so this is
Afterwards.
interesting for the patients because in reality we have papers showing that after 6 months, not of bandaging, but of graduated compression stockings that might be also more cost effective to be used, you have to be reassessed for your risk factors, and then the specialist will tell you if you have to go for 2 years as in the past or even more, but it's actually not specified to go lifelong with bandages or with anticoagulation as well. So we see there is a lot of confusion on the topic. One last question for Yvonne. If she ever noticed commercials on the magazines, on television, or other forms of commercials talking about stockings or drugs or creams that could help her vein disappear.
Doña Ivonne, nos pregunta el doctor si usted durante, digamos, su experiencia ha visto medios de comunicación, revistas o televisión, algún tipo de anuncios sobre el uso de medias, cremas o medicamentos, haciéndole la presunción de que si usted las utiliza va a desaparecer el problema venoso.
Claro, es una gran ayuda porque se sabe, aprendí a leer y también a orientarme por los excelentes médicos como usted, que nos recomiendan y sabemos que el sistema venoso con una media compresión va a trabajar mucho mejor todo lo que es el sistema venoso, ¿verdad? Y
una pregunta, doña Ivonne. Perdón que le interrumpa para replantear un poco la idea. ¿Usted
claro.
cree que tal vez hubo algún anuncio que tal vez le diera una falsa idea de que iba a ser como algo milagroso o que iba a resolver el problema venoso que usted tenía en la televisión sobre alguna crema o sobre alguna cosa que tal vez le generaron una falsa expectativa sobre algún producto?
Claro que sí, en la televisión siempre pues se dan muchísimos anuncios, también por medio de todas las publicidades, donde decían que habían cremas milagrosas, cremas y demás, pero yo sinceramente no creo en eso hasta que científicamente esté comprobado y haya pasado por varios mecanismos de seguridad, ¿verdad? Y que venga de una persona totalmente profesional para mi tratamiento. Entonces, yo confío solamente en los medicamentos que están, pero sí se ha escuchado y siempre se dice, ¿verdad? De cremas, ungüentos, inclusive toma de diferentes preparaciones, pero son realmente mitos y yo realmente si no están y no pasan por las fases que tienen que pasar científicas y comprobadas, yo no hago caso omiso, ¿verdad? De todos esos medicamentos.
Muchas gracias.
Thank you so much. This is very important, Yvonne, because for real, we are identifying a lot of fake products, fake claims, and indeed physicians are here also to advocate for patients' safety. With this, we have to close the coffee and water break. I finish mine as well. So we look forward for Pura Vena, Pura Vida moment in Costa Rica, and for the next chance to bring True Care as the name of this initiative. So thank you so much, Yvonne. Thank you so much, Silvia, and thank you so much, Lorena.
Thank
Thank you.
See you.
Thank you.
Bye-bye.
Thank you.